Turning 65 is a financial event. It sets a clock that the Social Security Administration will not reset. In the 7 months around your 65th birthday, 3 months before, the month of, and 3 months after, you have an initial enrollment window for Medicare. Miss it and the penalty is 10% added to your Part B premium for every full year you delayed. For life. Not one time. Not until you catch up. For life. For a military retiree on TRICARE for life. Missing Part B is worse than a penalty. It cancels the TRICARE wraparound entirely. Over the next 10 minutes, we're going to walk through the full healthcare picture for a veteran entering retirement. VA healthcare and the priority group system. CHAMPVA for dependents. Medicare Parts A and B at 65. How TRICARE for life stacks on top. The IRMA surcharge that quietly taxes higher-income retirees. And at the end, aid and attendance. A tax-free monthly pension that pays for long-term care and that most eligible veterans never apply for. Let's make sure you have every benefit you earned. VA healthcare is not one plan. It's 8. The VA assigns every enrolled veteran to a priority group, numbered 1 through 8. Group 1 is the highest. Service-connected disabilities rated 50% or higher. Former prisoners of war, Medal of Honor recipients. Group 8 is the lowest. Veterans with no service-connected disability and income above the national thresholds. Your priority group determines 3 things. Your co-pays. Veterans in groups 1 through 5 generally pay nothing for VA care. Your access. Higher groups get scheduled first. And your eligibility for services like dental and hearing aids. Here's the part every veteran should hear. Enroll anyway. Even if you have Medicare. Even if you have TRICARE. Even if you have private insurance through a spouse. VA enrollment is free. It costs you nothing to carry, and it keeps a door open. If your financial situation changes, if a service-connected condition worsens, if you need a benefit the VA offers and your other coverage does not, you already have access. Apply online at va.gov with VA Form 10-10EZ or walk into any VA medical center. CHAMPVA, the Civilian Health and Medical Program of the Department of Veterans Affairs, covers your family in 3 situations. First, if you are a veteran rated permanently and totally disabled by the VA, your spouse and children are eligible. Second, if you die from a service-connected condition, your surviving spouse and children are eligible. Third, if you were permanently and totally disabled at the time of death from any cause, your surviving family is eligible. CHAMPVA pays 75% of allowable charges. The deductible is $50 per person, $100 per family per calendar year, and the out-of-pocket maximum is $3,000 per family per year. After that, CHAMPVA covers everything. The enrollment rule most families miss. CHAMPVA is secondary to Medicare. When a CHAMPVA-eligible dependent turns 65, they must enroll in Medicare Parts A and B to keep CHAMPVA coverage. Same rule as TRICARE for life. Medicare comes first, the wrap comes second. Medicare has 4 parts. Part A, hospital insurance. Free for most people with a work history of 40 quarters. Part B, medical insurance for doctor visits, labs, and outpatient care. With a standard premium projected near $185 per month in 2026. Part C, Medicare Advantage, a private plan alternative. Part D, prescription drug coverage. 3 dates matter. The month you turn 65, the 3 months before, and the 3 months after. That 7-month window is your initial enrollment period. Enroll during it, and you pay the standard premium. Miss it, and 2 penalties attach. The Part B late enrollment penalty adds 10% to your premium for every full 12 months you delayed, and it follows you for life. The Part D penalty is 1% of the national base premium per month of delay, also for life. A veteran who enrolls 3 years late pays 30% more than the standard premium every month for the rest of their life. If you miss the window entirely, the general enrollment period runs every January 1st through March 31st, but coverage doesn't begin until July 1st, and the penalties still apply. Mark the calendar. TRICARE for Life is the retirement healthcare benefit for military retirees, reservists eligible at 60, and their family members. It is the best secondary insurance in the country. Here's how it works. At 65, Medicare becomes your primary insurance. Medicare pays first. TRICARE for Life pays what Medicare does not cover: the Part A deductible, the Part B coinsurance. Services Medicare excludes that TRICARE covers. For most retirees using Medicare accepting providers, out-of-pocket cost approaches zero. One rule, non-negotiable. To keep TRICARE for Life, you must be enrolled in Medicare Part B. If you skip Part B to save the premium because you think the VA covers you for any reason, you lose TRICARE for Life coverage the day Medicare eligibility begins. This is the most expensive mistake military retirees make at 65. Enroll in Part B during your initial enrollment period. TRICARE for Life coverage continues automatically as long as you pay your Part B premium. Medicare Parts B and D premiums are not the same for everyone. Higher income retirees pay more through a surcharge called RMA, the income-related monthly adjustment amount. The thresholds are indexed annually. For 2026, the first IRMA tier begins at roughly $106,000 in modified adjusted gross income for a single filer, or $212,000 for a married couple filing jointly. Cross the threshold by $1, and your monthly Medicare premium jumps by roughly $70. Cross into higher tiers, and the surcharge climbs to $400 or more per month. The wrinkle, IRMA, is based on your tax return from 2 years ago. Your 2024 income determines your 2026 Medicare premium. That 2-year lag creates a planning opportunity. Roth conversions, large TSP or IRA withdrawals, the sale of a long-held asset, each of these adds to your modified adjusted gross income and can push you across an ERMA tier. Plan withdrawals. Stagger conversions. If a one-time income event pushed you over, death of a spouse, loss of pension income, divorce, file Form SSA 44 and request a reconsideration. The SSA will adjust based on current circumstances. Aid and attendance is a VA pension enhancement for wartime veterans and their surviving spouses who need help with daily living. To qualify, the veteran must have served at least 90 days on active duty with at least 1 day during a wartime period, received a discharge that was not dishonorable, and be age 65 or older or permanently disabled. The veteran or spouse must need help with at least 2 activities of daily living: bathing, dressing, eating, toileting, or mobility, or require supervision due to cognitive impairment. The 2026 monthly rates: $2,424 for a single veteran, $2,874 for a married veteran, $3,845 for 2 married veterans who both qualify, $1,558 for a surviving spouse. All of it tax-free. The financial rule: your net worth must be below $163,699 in 2026. That includes assets plus annual income, minus unreimbursed medical expenses. The VA applies a 3-year look-back period on asset transfers. gifts, trusts, transfers to family. If they happened in the 36 months before the claim, they can disqualify you. One warning: if you enter a Medicaid-funded nursing facility, the VA pension drops to roughly $90 per month. Medicaid has its own asset limits and its own look-back. If long-term care is on the horizon, talk to an elder law attorney before transferring assets. The rules for aid and attendance in Medicaid are different, and getting them wrong is expensive. Before next session, 4 actions. First, if you are not yet 65 and are not enrolled in VA healthcare, apply. VA Form 1010EZ, online at VA.gov or in person at any VA medical center. It costs nothing. Second, if you are approaching 65, put the dates of your Medicare initial enrollment period on the calendar. 3 months before your birthday month through 3 months after. Third, if you are already on Medicare and are planning Roth conversions or large retirement withdrawals, run the ERMA math before you execute. The 2-year lag means today's decision is a future premium. Fourth, if a parent or spouse needs help with daily living and served in wartime, look up aid and attendance. Most eligible families never apply. Next module, we move to managing retirement income. Tax-efficient withdrawal sequencing, required minimum distributions, and how the state you retire in changes the math. Bring your account statements. We'll get to work.